If you want to do something for the holidays that makes a difference beyond wrapping a present or putting up a Christmas tree or doing something festive, the best thing that you can do is find a senior in the community that lives by themselves and spend time with that senior. Bring them a meal, sit down with them, and develop a meaningful relationship.
Hello, everyone, and thank you for joining us for another episode of your Health Matters podcast. Before we get to our episode today, I want to take a moment to invite you to subscribe to our YouTube channel. This allows you to receive notification once we have new episodes posted. Also, the podcast is available on Spotify. We truly appreciate your support. In this episode, we are going to be discussing social isolation and loneliness. A few months ago, I was doing some research on a talk I was preparing on hypertension and came across the United States Surgeon General's advisory on isolation and loneliness. And what caught my attention was that the advisory described isolation and loneliness as an epidemic. We know we've all been through a pandemic, so anytime the word epidemic or pandemic is used, it gets one's attention, right? So I wanted to know more. So I dug into that report, and by the end of it, I knew this was a topic we had to cover. If you're wondering what the advisory is, why the Surgeon General's advisory should be something we're paying attention to, you're not alone. Until I stumbled on that report, I had no idea something like that existed. And apparently, those are only released when we have an urgent public health issue. And based on the topics we cover in this podcast, I want to just share a little bit from that report that hopefully begins to paint the picture of why this is such an important thing. Evidence linking social connection to physical health is strongest in heart disease and stroke outcomes. Loneliness and social isolation increase the risk of premature death by 26% and 29%, respectively. Lacking social connection can increase the risk of premature death as much as smoking up to 15 cigarettes a day. Think about that. That is really something we should all be concerned about. So, joining me today to cover this in depth and explore ways we can improve our social connections are Wanda Smith and Dr. Nkossi Dambita. Ms. Wanda Smith is a licensed social worker with more than 30 years of experience in the social work profession. She has worked in various administrative and leadership positions within the private sector and government organizations. As an adult protective service supervisor, she was responsible for case management services to adults at risk for abuse, neglect, and exploitation. She currently holds the position of social worker for the African American Health Program and is primarily involved in activities related to mental health. Dr. Dambita is the clinical director of the African American Health Program in Montgomery County, Maryland, a position he has held for 8 years. He is a public health physician with over 40 years of practice. He has directed multiple local, state, and international public health programs. He is a teacher at heart. He is a retired faculty member from the Johns Hopkins University of Medicine. He is passionate about his current mission of eliminating health disparities in the Black population. Dr. Dambita, Miss Wanda Smith, welcome to the show.
Thank you very much for having me.
Thank you for having us. It's quite a pleasure.
Awesome. I am super excited to have you all today. You all have so much experience in this field, and I can't wait for us to get into this and really find out more about this topic and why it's such an important thing to be thinking about, especially this time of the year. Wonder, I want to start with you. Are you surprised by the fact that loneliness and social isolation are being discussed as the silent epidemic in our community?
No, I'm not surprised. And as an adult protective services social worker, I regularly encountered individuals who were isolated and who were lonely, and the pandemic even intensified that as well. And it was not uncommon to find individuals that did not have social connections in order to help them thrive. And generally, when you find individuals in this position, there are health issues and mental health issues as a result of lacking those important social connections. So this does not surprise me at all.
What about you, Dr. Dambita? Are you surprised
I
at all?
am not surprised at all. Concur with everything that Wanda stated. And I just want to add that remember that we are social animals and we need the connections. As much as we need air to breathe, those connections are important. And when we have concurrently to live a lonely life, isolated life, and we all experienced that during the pandemic as really a very serious burden on the psyche, on everything that we do. And that's one of the worst things that can happen to a human being. And when we live this modern world with so many distractions and so many things going on with individual pursuit and what have you, a lot of people feel isolated in our society.
I'm glad you mentioned COVID 19, the pandemic. I think that was the first time in my experience that I noticed isolation and loneliness coming up in the national conversation. But I think even before then, it was already happening. If you think about how many people are reporting of feeling isolated and lonely, that number is roughly around 50%, which is above the number of people diagnosed with obesity. So I think even before the pandemic, we already had this issue. So what do you guys think? Are we raising enough awareness about this as additional risk to chronic health conditions prevention and management? Or is this something that we really don't talk about until we have something like a pandemic?
I want to say that it is found that individuals who are lonely and who are isolated are at risk for depression and even suicide when they don't have those social connections, someone to talk to check in on them, to see how they're doing. It basically affects their mental health, and anything that affects your mental health affects your physical health as well. You either overeat or you undereat or you don't eat at all. You don't sleep or your mind is racing, and all those things impact your physical health. And people who are lonely, who are isolated, are not caring for themselves, have more of a risk for suicide than someone who has social connections in their life, having meaningful interactions with individuals.
What about in young adults and even children?
And that's what brings that rate up to 50%. Young people, they have, in today's world, they have to fend for themselves. We no longer have the network, the safety net that was were characteristic of maybe prior generations. And they find themselves in this situation and with very few resources available, without any guidance, without any cookbook, as it were, to navigate to a very complex society. You have this artificial world that they create through technology, which is not real. In order to be really social, it has to be genuine relationship. It has to be a true relationship. It has to be a meaningful connection.
The pandemic really taught us a lot. It really manifested itself as never before, especially children that were in school. Now they're at home, they're sitting behind a computer, they don't have the interaction with their peers that they did before the pandemic. And it's basically them and the computer. That's how they were interacting with their teacher. And now we're seeing the effects on academic achievement, how it has been lowered as a result of those social connections being missed in the classroom. We have social media and all of these sophisticated games, and so children are really on the computer a lot. It is affecting them.
And I think that's something that, yes, the pandemic brought it out, but it was already a trend happening. But it just got worse with the pandemic, where we have children now exposed to so much more screen time and social media as a way of learning and connecting. Part of that report I mentioned earlier, there were studies quoted that said 1 in 3 US adults report they are online almost constantly. And this number doubled in young adults. More and more people are spending a lot of time on social media platforms, but I don't think that it's necessarily improving the kind of connections that we are having. What do you think about social media? Has it really helped us, or has it made this worse? What are the good and the bad of social media in terms of managing opportunities for social connections?
Yeah, I think there's the good, bad, and the ugly when it comes to social media. The good is people are establishing some connection, renewing contact with old friends and things like that. That happens, and it's good if you've lost them for a long time and you have that longing, that can satisfy that. But very quickly, we realize that, first of all, the bad is it does take up quite a bit of time, as you mentioned, be it on the phone or the different platforms, and getting involved in activities that are not really, do not have any deep meaning in terms of quality of life. And to me, that's time wasted. It can't match having a face-to-face interaction with a parent, with a friend, or something like that. It's an artificial world that you think you live in it until that breaks down. And then that's when people begin having that loneliness feeling. You're in a crowd, but you feel lonely. And that's the ugly part of the social media. It dehumanizes other people. It bullies some people to the point of suicide or to hurt other individuals. And that's very ugly.
But I think this is a good point to really explain the difference between social isolation and loneliness. So you can really have a lot of opportunities for social connection, but still feel lonely, which is what we are seeing in the social media. Well, you can have what? 10,000 people like your page, but still feel lonely, right? You feel like you have all these people are part of your community. But if that is not addressing your needs and what you need out of this community, you can still end up feeling lonely. And if you end up being a victim of bullying, cyberbullying, or that community turns on you, it can quickly become a very lonely if that's your only source of social connection. So, what do you think, Wanda? What are you seeing? Do you think social media has helped or worsened our epidemic of loneliness?
When you're looking at things like Facebook or Instagram or Twitter or some of the other things, there are some falsehoods that can affect people. You're looking at people who are traveling and they've got lots of friends, and you don't have that kind of life. So that's going to affect your self esteem. You're going to feel bad because you're not popular and you don't have 1,000 friends on Facebook. You only have 200. Or even your body image. Maybe you are a person who is obese and you're looking at folks that you know that are gorgeous and they have beautiful bodies, and you're feeling very bad about yourself. And so that's going to affect your self image. And then also the safety aspect of it. You are experimenting on things because you want to be that person or you want to be in that crowd. It's kind of like a fantasy to be on Facebook and to see things. And I think it definitely does affect your sense of loneliness because It's just a tool. It's not where you can develop so good relationships with people. You have to be careful on the type of relationships. As Dr. Dambita said, a lot of nefarious activity happens where people commit suicide, or they may be lured into child solicitation or exploitation activities. But I do think that it is contributes to loneliness, because people don't need other people. When you have your telephone and social media, that's all you need to do. You just sit and just scroll through all day and just see what people are doing. And TikTok's the new thing. And it's just basically you and the phone and the computer. That's it. No social interaction or friendships or any deep and impactful relationships.
Social media can be a great in terms of creating some opportunities for connection, but we have to be careful that it does not replace that in-person interactions. There are some benefits, but we cannot forget what we get when we actually sit across from another human being and get to interact with them. That has a lot of value. In addition to that, even to make matters worse, one thing, if you have Facebook, Instagram, and you mentioned TikTok, we also have AI generated, artificial intelligence generating this gorgeous looking humans. I can't even call them humans because they're not real. We have all this now distorted perception of what people should look like, right? And that's affecting how we see ourselves, our self esteem, especially young people who spend so much time. Maybe don't even say young people. If you spend so much time on social media, it affects how you see the world, and you might begin to feel bad about yourself. Like I said, contributing again to that feeling of being lonely or isolated.
I just want to also note that even parenting, it's easier to stick your child in front of a television set, and I've seen children as young as 5 years old with iPhone. And it's easy to give your child an iPhone or have your child play video games all day or watch television than it is to take them to the park, walk them down to the park and let them play at the playground, or participate in activities with other children, or even sit and read your child a book, or teach your child other activities that are impactful in terms of parenting. So it really has become the babysitter. And that's, for many children, that's all they know is just the TV and other devices that they can connect with.
We teach them that's a way to interact. We think that it's a good way to stimulate them. And we let the TV, those TV programming, raise them. And that happens because we don't have time. We cannot manage times effectively in order to be there for them. I've seen that with my own kids, where they, even though we try really hard to keep them away, to limit the television time, they didn't have phones until they were about 13, 12, 13. But once they discovered it, it was a constant pressure from their friends and so forth, because they wanted to connect, to be in with other groups. And that, when they became this kind of socialization, then I can see signs of disappointments, the particular group they're in, the anger, and all these different feelings that comes out of being isolated for one reason or the other. And once you're in it, how you react matters. How you deal with that isolation can lead you on the path to loneliness. And loneliness would create all kinds of the problem in terms of health, we know already.
I also wanted to say that there have been studies on newborns, and they find that children, when they're born and they lack the social connection, or they have the love or someone that's holding them and showing attachment, that this really does affect the child's ability to survive.
Good points you make. Let's talk about on an individual, and then we'll get to a community level. We know that having a chronic health condition, diabetes, or having experienced a cardiovascular event like heart attack can increase your risk for social isolation and can also make you feel lonely. So let's start with you, Wanda. What are some of the other individual risk factors for social isolation and loneliness?
Mental health disorders. There are several health disorders where individuals are isolated. There's a personality disorder called schizoid, and they are generally, the characteristics are loneliness. They don't want interaction with people. They live with their parents. They really don't move out the house or have a job, or they work midnight or in a factory somewhere where there are a lot of people, or avoidance personality, where a person avoids having contact with individuals. And then you also have phobias, where there are people who are afraid to come out during the day, or you have a social anxiety. And these are mental health disorders where people actually avoid having a social contact, and they need counseling, they need medication therapy to kind of help them. And then also, in my experience as an adult protective services worker, there were people who had hoarding behaviors, and they did not want to leave their surroundings and were not able to take care of themselves. And so there are a lot of situations, mental and physical, where people are subjected to isolation and loneliness.
You talk about mental health being really key. If you already are diagnosed with a mental health condition, it can affect, your ability to socially connect, and also can lead to loneliness as well. The lack of people in your life, maybe it could be a spouse, it could be family checking in, or even neighbors, right? Not having that kind of interactions of people in your life who can do that and check on you can also contribute to loneliness and isolation. We talk about having a stroke, we talk about having a heart attack, or even diabetes, hypertension, and not even having the right care team can all contribute to people increase their risk for loneliness and isolation. I think all of us here can remember that saying, it takes a village, right, to raise a child. And I think the whole idea was, we had all these meaningful connections where people, auntie, neighbors, everyone was involved in the well-being and care for each and everyone's. We always took care of each other. But that is changing in how we live our lives now. And I can tell you, I know friends who tell me they don't even know their neighbor's name, let alone remember the last time they said hello to the person who lives across the street. So that is also contributing to social isolation. Dr. Dambita,
Oh,
what do you think about that?
absolutely. And I want to go back to what Wanda said earlier, because it's important as an aspect of mental health that we are neglecting. And there is a condition, agoraphobia, anxiety driven, fear of being in contact of people. And if you in that condition, you can't really establish meaningful relationship that leads to self-isolation and loneliness. You mentioned the importance of family connections and so forth, and how that has changed, and and that's particularly poignant if you're coming from the African society, when you mentioned is a village that raises you. You find it really difficult to navigate all that. Something that affects the elderly as well. Hearing. People who don't hear well, they will avoid social gathering, because having that stigma of having to repeat yourself all the time, and all this anxiety driven. Wanda mentioned, she's an expert in that. So it's all under the umbrella of mental health that plays a tremendous role.
It's holiday season, and there is a condition they call the holiday blues. And on TV, everybody's happy, and the families around the table, and everyone is enjoying themselves. And this is the season to be jolly. But for many people, it's not like that. Some people have lost someone. Some folks are in the other side of the country or the other side of the world, and they're not around their family. Some people don't have any social connections, and here it is, a holiday, and they're by themselves. And so, as a result of missing those social connections, they are depressed and sad. And this is not such a good holiday or event for them. during the Christmas and Thanksgiving time is actually very painful. And it's just times like this where people start experiencing depression and sadness because they're not around that family unit where they experience love and support.
This is big. We have to keep in mind that the holidays, it's not always a cheerful time and happy time for a lot of people. It can be very depressing, especially when you have all those images on TV. You have all these happy, beautiful families, and you are not experiencing the same. Nor do you even have one or two people who've even bothered to call and see how you're doing. So it can be very depressing. And thank you for bringing that point. And I know this episode will be released during the holiday season. And I really hope that everyone who's listening to this, it is an opportunity. Check on a loved one, check on your neighbor, call, say a kind word to a stranger. It's not necessarily all good just because we're celebrating the holidays.
People who are experiencing loneliness or sadness, we offer other tools or things that they can do. Go out and volunteer, do something for someone that you know, or go visit a senior, go help with food distribution, or something where you have interaction that would keep you from feeling sad or down, or join in a party or a gathering where you can be around individuals and not be by yourself and be subjected to sadness or and depression and anxiety, but try to engage in some activities that will help you feel a lot better during the holiday.
I really want us to focus a little bit of time talking about the link between the isolation and loneliness and your ability to manage diabetes or hypertension. And a lot of the studies have shown that family involvement have a big impact in your ability to prevent type 2. And if you already are living with diabetes, it can make a big difference in how you self manage doing all those things we know are all important in preventing complications. Well, Dr. Dambita, I know you're actively involved in the study right now, which is looking at family unit in preventing type 2 diabetes. I believe it's called Families Define
Yes.
Diabetes Together. So, talk about the limitation of willpower and the benefit of approaching chronic health conditions as a family, which goes back to social connections and reducing the risk of loneliness.
Absolutely. And this is one of the things that we believe we're onto something. In fact, just a little plug, if anyone would like to join that study, we are recruiting 12 new families for a new cohort in January. And the idea is simple. When you look at diabetes management, it's a lonely, very lonely affair. You go to your doctor, the interaction is often not very satisfactory because in 15 minutes, your doctor cannot explain to you all that it takes in terms of managing your diet. You take the prescription, you go to the pharmacist. Some of them, if you go to the CVSs and so forth, the pharmacists do not have the time. Those people need to have access to nutritionists. There are many resources to explain to them the importance of exercise. All those things are family activities. If you do it together, if you have to modify your diet, the other members of your families, they have to be in the game. They have to participate in the game. So that family dynamic is important. We take both the person with diabetes and the person at risk. We manage them for a period of 20 weeks and see if that makes any difference. If it does, then it's a great thing for family.
Awesome. And there are a lot of studies too that could point to if you have three or four of your friends are overweight or don't exercise or don't have healthy eating habits, the odds are you are also doing the same thing. So there is power in those social connections doing things together. And I think this is a great way then for us to discuss the benefits, right? What are some of the things we can begin to do? I think we've covered enough about what it is, how this affects the health. Now let's empower each other now with things that can actually make a difference.
I would say turn off the TV and limit your social media and really make a concerted effort to go out and meet people. There are so many opportunities for socialization. Churches have lots of ways that people can socialize. There are a lot of organizations in the community that help others, certainly volunteering, helping people that are disadvantaged, going into the schools and helping to mentor children, and just looking in on your own family. Aunt Gladys, who's 87 years old and lives on the other side of the country, go see her. Make an effort to call her on a regular basis. So I think we as individuals, we are responsible for ourselves, and we can definitely learn to work with other people. And if you feel that you are struggling and you're going through things, get some help. There is therapy out there that can help you if you're having issues with it, meeting people or interacting with people, fear and being out in public. Get some help. But really do what you can for yourself so that you can live a meaningful and healthy life and have love and support.
I echo everything that Wanda has said. You have to make the effort to seek out those connections. If you live in the same city with a brother, sister, mother, uncle, fun is okay. But said, okay, this holiday or this time, I'm going to be physical. I'm going to show up and get a hug or something. You're in a supermarket, do a totally random act of kindness. Offer to pay for the person that is following you. It's amazing the effect that had would have on people. And there is nothing better to remove stress than to be in the company of people that you love.
It doesn't have to be something big. Volunteering, like you both have mentioned, doing a kind thing for someone else can make a big difference. And as clinicians and those involved in healthcare, we have to do a better job too, asking about social isolation and people's ability to connect, and also have tools to help us be able to identify when someone is experiencing loneliness, since we know this can really have a big effect on mortality and the ability to manage. It's one thing to identify, it's another thing to know about the resources that are available in the community where they can say, hey, we have the African American Health Program. I have to say that is an excellent. You guys are doing an amazing job. I tell you, if you're listening and you're in Maryland, in the United States, Maryland, Montgomery County in particular, you need to check them out. They do such amazing work in the community. I am so proud that I can be able to contribute at least one day a week to the programs that they have. So please, if you have someone living in Montgomery County, in Maryland, and you think that they are struggling with any chronic health condition, please reach out to them. And we'll have their information in the notes. So don't worry, we'll have the contacts listed with this episode. But opportunities like that are really important. So family is great. It's really encouraged, but there are other avenues, your churches, houses of worship, programs like this, whether it's through the county or through private organizations, can all make a big difference.
We are family. That's how we consider ourselves, to be a family. You can be part of that family, and we will look after one another. That's all I can say about the African American Health Program.
So let's talk about society wise, though. What are some of the things, if you're looking at it from a broader lens, what are some of the other things that people should be looking at when they're trying to find communities to live in so that they don't end up finding themselves isolated? So, what are some of the things that really should be happening in every community or exist as resources to minimize the risk of isolation?
I think I'm going to leave that to the social engineers and ask them to bring a little bit of love, empathy into their policies. And that's what is lacking. And that has to change. And I think at the individual level, nothing is more potent than love. But the policymakers, politicians, and so forth need to tame their language. They need to show more compassion, and they have to bring back the sense of belonging. We can't continue to antagonize one another. You're in one particular political party, the other that are not in your party, they're not the enemy. You may just have some differences in the way you view the world or the way you want to approach the world. That's something that our politicians have a lot to do. They are failing us. I'm not afraid to say that. They are failing us. They need to do a better job.
We should create environments where people can interact. Schools that are walking distance. There are a lot of communities that have food deserts where it's all fast food and you can drive through and just grab stuff. But now people are making community gardens where people can come in and grow fresh fruits and vegetables and interact with their neighbors. And transportation where people can get back and forth to work and school. And grocery stores where people can go into the grocery store and get to interact with individuals. Schools that have programs where parents can come in and be more involved, or where the community can come in and help the children. And then also, there should be good senior centers and activities for seniors. And there should be involvement in the community where people can come together and get to know each other and learn to interact and develop those relationships. That's going to help the community thrive. And also social services to be able to provide individuals with those things that individuals need to be the very best that they can be. Provide mothers with programs so that they can feed their children and provide them with milk and diapers and health insurance where they can get good health insurance that will prevent them from getting diabetes or having heart attacks and heart issues and things like that. So I think government is very important in terms of the programs that we offer people, and also the environment that we live in that's conducive to people interacting and involving one another, where people don't have to live in social isolation and loneliness, and those services are available that can benefit people's lives and help them to have longevity and be healthier and have social connections needed to thrive in this society.
And I want to stress the point that this applies to almost every community in the world now. I know we've talked about examples in our own backyard here in the United States, but if you look at societies across the world, it is changing. This is something that all of us as humans, regardless of where we are in the world, some might be experiencing it more than others. We really need to think about how we are interacting with each other. What kind of communities are we creating? Is it one fostering acceptance, inclusion, and we're providing opportunities for us to stay connected and minimize loneliness? These are all things that each and every one of us have to be thinking about, what we are doing individually to contribute. We also think about who we are electing. Hey, we cannot forget that. The people we are choosing to represent us, our values, and what we stand for, are they truly using that power to create more connected societies, one that has a lot of empathy and respect people's humanity? So each and every one of us have a role to play. And it goes to the Surgeon General's call to action in that report. He asks each and every one of us that we should really start now in our own lives and look at ways in which we can strengthen our own connections and relationships. So I want each of you to leave our audience with one or two things.
We are one in this world. And if you want to do something for the holidays that makes a difference beyond wrapping a present or putting up a Christmas tree or doing something festive, the best thing that you can do is find a senior in the community that lives by themselves and spend time with that senior. Bring them a meal, sit down with them, and develop a meaningful relationship with them. We at the African American community, we visit shelters on a monthly basis. We visit about 4 homeless shelters for men and women. Go to the shelter, bring clothes, bring something that's going to let the individual know that they are loved and that their life is of value and that they're meaningful, and work to develop relationships and help them to integrate back in the community and be a meaningful contributor to the community. So we will make such a difference in another person's life.
Don't be afraid to call for help. Don't be afraid to use the phone, the social media to get help, not just to entertain yourself. It's hard to find, but if you hook up with organizations such as ours, we can direct you. We would not have all the solution, but we will direct you. And just be kind, show kindness this during this period of holidays, and do take care of yourself.
I like that as a way to end this episode. Thank you both so much for coming on and sharing so many wonderful tips on what we can each do today, starting today, to continue to strengthen our connections and reduce the risk of loneliness. Thank you so much, Wanda Smith. Dr. Dambita. And for everyone else, truly appreciate you. We hope you have a wonderful holiday season. You're staying safe. And most importantly, say something kind to the stranger you meet on the street. Check on your neighbors, call your friends and family. Visit if you can. In person interactions are always great. They will love you for it, and you will be doing something great for them as well. We are going to be including all the links to the wonderful information shared here, how to reach out to the African American Health Program, see what they have, and how you can also take advantage of all the resources that we have in the community as well. So, thank you all. Subscribe, share this episode with a loved one, anyone who could benefit from this. We truly appreciate you all listening every time we drop a new episode. And until we meet again, have a safe and wonderful holiday. And remember, your health matters.